In this video, we will be talking about the eye, the bulbar part of the eye, or the eye proper. Obviously, this eye doesn't have the superior and inferior eyelids attached to it, but one thing that we can see out here is that third eyelid, or the nictitating membrane. And remember that there is a lacrimal gland located within that nictitating or membrane, or the third eyelid. When we talk about the parts of the eye, there is an outer area, or the fibrous tunic of the eye, and that is comprised of the cornea as well as the sclera. So that's the fibrous or outer tunic of the eye, cornea and sclera. The cornea should normally be clear. It has epithelium on its inner and outer side that will keep liquid out of the stroma, or middle part of the cornea, and that is why the cornea should be clear. The area where the cornea meets the sclera is called the limbus of the eye. So it has its own particular name, and one of the things that we can see a little bit on this eye is part of the conjunctiva, the bulbar conjunctiva on the surface of that sclera. So that would be our fibrous or outer tunic. And if I take this off, we only have half of the little cornea. But if you look around here, you can see this very dense white fibrous outer layer, and that would be the sclera of the fibrous tunic. The next layer in would be our vascular or middle tunic, and that is called the choroid. The choroid is going to have all the vessels associated with it that will supply the retina, which we can actually see here. I don't want to peel that quite off yet. As well as the iris and the ciliary body. So if we look at the inside of this eye, we can see that right here would be the iris. The iris is going to be the colored part of your eye. And the hole in the middle would be called the pupil. And then behind that is going to be the ciliary body and its processes. So I have both halves of this eye, and on each of those you can see this space here would be the pupil, the iris, and the ciliary body and all of its processes. So the choroid, the vascular layer, the iris, and the ciliary body and its processes will make up the middle, or the vascular tunic of the eye. Sometimes you'll hear that referred to as the uvea as well. UVEA. Okay, so from outside to inside, we did cornea and sclera for the outer fibrous tunic, choroid, ciliary body, and processes in the iris for the middle or vascular tunic. And our internal or nervous layer would be comprised of the retina. The retina is where all of those impulses that are going to be coming in through that pupil, through the cornea, through the pupil, and hitting the back of the eye are going to focus in on this, whoops, let me just throw this around a little bit. Just did a triple axle. On this retinal layer, okay? Now, the retina in the pars optica part of the retina, which lays on the back side of the eye, has multiple layers to it. It's like 7 some histological layers, okay? This is where all the rods and cones are going to be associated. And in a cadaver eye such as this, if I pull off pieces of that come clean off, that is just that nervous part of the retina falling off by itself. underneath that retina and the optical part, we can see this very shiny area, and that is called the tapetum lucidum. The tapetum lucidum is actually part of choroid. Okay, it's associated with that vascular tunic. But the reason that we can see that tapetum lucidum is because there is no pigment in the pigmented retinal epithelium. So we talked about this nervous part of the retina, and underneath it is going to be pigmented retinal epithelium. As it turns out, there just is no pigment in this one particular area, which makes that tapetum nice and reflective for light and helping animals see during the night. So all of the dark area that you see here would be pigment in the pigmented retinal epithelium. And then that retinal epithelium will then come, let's stick this back on here, that pars ciliaris retina, okay? There'll be retinal epithelium that lines the ciliary body and its processes, and it's pigmented, i.e. it's dark and black. And then there'll be pars iridica retina, again, pigmented retinal epithelium on the back side of that iris. So just to recap a little bit about that nervous tunic, we had pars optica retina, where the rods and cones are. This is that part that falls away. The pigmented retinal epithelium is present for most of this pars optica, except for where the tapetum is. And then that retinal epithelium will continue on to the ciliary body, its processes, as well as the iris. Let me just point out one little thing. Where that tissue doesn't come away, that is where the optic nerve is. And that is often referred to as the optic disc. So when you're doing a fundoscopic exam, you can actually see this big white blob or circle, and that would be the optic disc, and you should see retinal vessels coming or radiating out from that. One of the things that's missing from this eye is the lens. And the lens is going to be located in approximately this area, attached to the ciliary body and processes by what we refer to as zonulary fibers. These are very delicate, thin fibers that hold that lens properly in place. Behind the lens, and all the way caudally, is going to be our vitreous chamber. And in that vitreous chamber would be vitreous humor. And that vitreous humor is going to be that jelly-like substance that we'll find when we so that vitreous humor is going to be located in the vitreous chamber, caudal to the iris. Caudal to the lens. Cranial to the lens then, or rostral to it, we would have the aqueous humor. And let's just talk a little bit about aqueous humor production. It is produced by the retinal epithelium on the ciliary body and processes. It goes into this little teeny area here called the posterior chamber. From the posterior chamber, it goes through the pupil, that little space, and into this whole area called the anterior chamber of the eye. From the anterior chamber of the eye, it then gets absorbed into all the way around the entire circumference of the eye at this area called the iridocorneal angle. Can you see it? Yeah. Pretty good? Okay. So right in here is iridocorneal angle. iris, cornea. Makes sense. Gotta like it.
I did not.
Gotta like
Oh,
that. All right. So, cornea, anterior chamber is the space. Then posterior chamber would be here. Then the lens would be located in the vitreous chamber behind that. I think that concludes our discussion of the eye.